Hello, I'm Alice Liu, PGY3 with OSU Family Medicine. I will be presenting the QI project on the topic of analyzing and improving reporting, compliance, and completion of annual chlamydia screening for qualifying patients within the OSU Family Medicine residency clinic system. The other co-author of the project is Dr. Jaylene Hayes, and our faculty advisor is Dr. Laura Cotton. Chlamydia trachomatis is the most commonly reported bacterial STI in the United States. Nearly two-thirds of all reported chlamydia cases occurred among sexually active adolescents and young adults aged 15 to 24 years old. If left untreated, chlamydia infections can lead to significant reproductive health complications, indicating the importance of screening. According to the USPSTF and CDC guidelines, it is recommended that all sexually active females aged 15 to 24 should receive annual chlamydia screening. For females aged 25 years or older and sexually active males, chlamydia screening is also recommended for those with increased risks for infection. Studies have shown that the completion of chlamydia screening per guidelines are still suboptimal. At OSU, we utilize MIPS protocol as a tool to annually report and keep track of compliance of recommended screening done for qualified patients in order to help improve patient care quality. We noticed that some chlamydia screening results were not included in the formal MIPS reports due to being tested as part of the pap smear samples or were tested by providers outside of the OSU Family Medicine residency clinic system. It is difficult to track compliance of annual chlamydia screening without proper reporting. Thus, through this QI project, we aim to identify reasons why patients were labeled as not meeting the MIPS requirement. Based on the results, we then develop plans to improve proper reporting and also to increase provider awareness and compliance of the annual chlamydia screening for qualified patients. We began the process by obtaining the 2024 MIPS data for patients who met qualifying criteria for annual chlamydia screening during the year. We performed thorough chart review for each patient who were labeled as not completed and relabeled patient results as appropriate. We then calculated the percentage of missed reports versus those who truly did not have the annual screening done. We found that in 2024, 73% of eligible patients were labeled as not completed for the annual chlamydia screening. Overall, 19% had actually completed the screening but were not reported to the MIPS system, and 54% truly did not have the annual screening performed, indicating that there are significant numbers of chlamydia screening missed in the formal report due to the way the data was extracted from the electronic medical records. And there are still majority of patients who truly did not have the screening test completed per the guidelines, which indicates that the steps are needed to improve awareness and to increase completion of the screening within the OSU Family Medicine residency clinic system. We will incorporate reminders in our office note templates to raise awareness and improve compliance of chlamydia screening, and will also work with the health information technology team to improve the electronic reporting system to properly include all chlamydia screening results in the formal report. Thank you very much for listening. Please feel free to contact me if there are any questions.